Hi guys. So I already posted a video earlier today. Um, I was just talking about uh the fact that I was given instructions on Monday to double my Lupron, and I wasn't sure why. And I did talk about the fact that um I got answers today. Um, and so you know, ultimately things aren't going as expected. And true, like, I just want to talk right now about the reality that I call like spinning, um, or like heading down the rabbit hole. Um, because I really thought this time that I wouldn't do that. I knew that there was potential and that it may happen at some points. Um, my cycle um, includes a matrix test, which my dogs are being gooses. And the matrix test is basically, close to the end of my protocol. It's a very intensive ultrasound, which is sent away to be thoroughly studied and examined, and it comes back with a rating. Um, I don't exactly remember the numbers on it, but like I'm pretty sure, and I could be off on this. I think it's like if your rating comes back 7 or higher, then that's a really positive outlook for your uterine lining um, environment. And if it's 6 or lower, then it's just kind of not advised to move forward with a transfer. And I really thought trying to plan ahead and know where I needed to be really kind to myself, I thought that would be, it's a 24-hour waiting window. I thought that would be a main area for this, but because something unexpected has come up, which is that my E2 levels at this point are, and I did mention this in another video, but we'll just recap real quick. My E2 levels are currently 426, regardless of the fact that I've been taking the birth control pill initially, and then Lupron and the birth control pill, and now just Lupron. Yeah, they really want to see my levels at 300 or lower. So I have the details now. I was instructed to increase my Lupron, double my Lupron dosage for 4 days, go back in for blood work, and see if those numbers have improved. And if not, we may have to cancel this cycle. And I just I don't even have a script or talking points for this video, because I think if I'm really going to share with the community what assisted reproduction is like, I'm not always perfect, perfectly scripted, and I'm not, sometimes I'm struggling emotionally. And so I just want to share that if surprises come up along the way during your cycle, I'm sure there's plenty of people out there that can relate. So I just want to share, like, I'm doing it too. So I got the specifics from a nurse from my clinic about my E2 levels, which I didn't even know E2 is a thing. I thought estrogen was estrogen, but apparently there are 3 categories. And because I got that information from a nurse, I did have questions about it. But that wasn't the appropriate person to inquire with. That would have been more of a conversation for my doctor, who isn't available currently for me to ask those questions. So for that reason, I found myself today sort of spinning, and I'm sort of just recovering from that and trying to focus on this moment, this cycle, and keeping stress levels down, and ultimately just accepting that my results on Friday are going to be what they are. But I just want to share with you what my spinning looked like earlier today. So the first thing I did was hop onto Google, of course, and so my main question was this: so if my levels are 426 and they want to get me down to 300 or lower, I got to come down 126 points. So I have no idea what that scale looks like. Like if it's a broad scale, like if it's like, I don't know, a scale up to 700, then maybe coming down 126 is like not a large number to need to come down. And I was hoping to find some information on that and maybe just put myself at ease a little bit. That was ultimately my goal. And that was not easy information to find. In fact, WebMD was the only site I could find that actually provided any sort of numbers. And I tend to trust WebMD a little more. Obviously, we have to be cautious with what's out there online. But what I saw on WebMD was that apparently, like just before ovulation is when, during the female cycle, the E2 levels are at their highest, and normal high, according to this article, was 300, and anything over that, according to this article, is a cause for concern and could be an indication of ovarian cysts, ovarian tumors, or polycystic ovarian syndrome. So, of course, I kind of started spinning a little bit just because I do kind of fit the categories for that, possibly, with my medical history. Like, the medical aspect of my fertility journey started with, like, I had a 10 centimeter ovarian cyst that I did not even feel. I think this may have been 4 years ago. That sounds about right. 3 or 4 years ago. I didn't even feel it. And the only reason I even found out I had it was that I went for an ECG for just a baseline for another medical issue. And I was a bit late for my appointment. And when I got there, I had to pee, but I didn't have time. So I held it. And when I laid on that flat, hard table with a full bladder, my stomach literally had like this lump coming out of it. But I had no pain, nothing. And I kind of ignored it for a couple of days. And I thought, I'm gonna just like test myself again, because like I was about to go to the bathroom and I thought, I'm just gonna like lay like not on a mattress but like on my floor so that, you know, it would bring things up a little bit more. And that lump was still there. So I thought, anyway, I ended up going into the hospital to get it checked out. It was really difficult to diagnose because it was so big that the doctors actually thought my bladder wasn't emptying. So I was like catheterized and kept in the hospital for observation until they could do imaging. Long story short, yeah, they found out that I had a 10-centimeter cyst and I needed emergency surgery. Which, you know, once they got in there to do the surgery, that, okay, after a cyst hits a certain size, it's not medically classed as a cyst anymore. It's classed as a tumor. So yeah, tissue had gone, like, had, been growing off of my left ovary and then sort of like gone through my fallopian tube and on inside and outside through my uterus and partially into and around my right fallopian tube. So, you know, everything was removed. My tubes were cleared. The tissue was sent away for testing. It was benign, so that's all good, but obviously left a lot of damage there, which is why we started off with assisted reproduction. But that said, I'm talking about spinning and like going down the rabbit hole. So I read this article and, you know, my head starts going to, well, you know, I had a cyst that big with no pain. And I know a lot of women who have ovarian cysts, they feel pain when they pop. So it made me wonder, like, did I have cysts before that large tumor? Have I had cysts afterwards, and just not been aware? And how does that affect my reproductive treatment? But, you know, then I started to try and be as logical as I could about things. So, given that this article said that the highest E2 level, classed as normal for a woman, is 300, I'm like, this doesn't make sense because I'm down regulating right now and they want to get me to, like, a level of 300 or lower is acceptable. So I don't know. I guess my point is, like, I'm just left with like I had a lot of questions. And the other factor for me is that my husband and I have 3 frozen embryos, and they developed really well, and they were frozen at 5 days, which is blastocyst. They hit the blastocyst site or blastocyst phase at 5 days, which is optimal. So like we have, you know, good embryos, and we've just been at this for so long that I'm honestly at a point, like, it just seems like life is always getting in the way, or I'm having medical issues that are getting in the way of trying a frozen embryo transfer. And my mind is going to, like, negative space. Honestly. We had a big life change happen recently. And last January, we were like, okay, things have settled. And we're finally in a position to try a frozen embryo transfer. So because my initial IVF fresh transfer resulted in a miscarriage, my doctor wanted to do a sonohystogram, which is awesome. I appreciate him for being so thorough. And the results of the sonohystogram was that I had a hydrocephalus, which is essentially my left fallopian tube was fluid filled and like enlarged. So, um, it was, again, lucky that we caught it. And again, I didn't feel it because I was actually close to rupture. So I ended up going in for emergency surgery for that when I thought I was finally going to be able to do a cycle. And then I had to wait 3 months. Sorry, 3 regular periods, which fortunately came on properly for me. So 3 months before we could even consider another frozen embryo transfer. At which point we needed to relocate for my husband's work. And we relocated to a home that requires renovation. So we wanted to wait until phase 1 of renovation was complete because I was kind of here wearing the white hat and keeping everything on track. So we finally just finished that, and here we are thinking, okay, finally we can move forward with the frozen embryo transfer, and like now I'm getting concerned that not only we might have to cancel a cycle, and I do appreciate that my doctor is really thorough, and I'm afraid that, I don't know, I might have to wait more months and months and different cycles, and instead of doing another transfer, I may need to do more testing and wait for the results of that. And hopefully no more surgeries, but I don't know. And then my mind started going to like, my husband and I have like discussed surrogacy, what our comfort level would be. And we agreed that we're open-minded to it. It's not our first choice. I would like to carry myself, but I don't know. We'll wait and see. I'm also pretty emotional from the Lupron. And I'm like prescribed medication for anxiety as it is. And then one of the side effects of Lupron is anxiety and insomnia. So it's not really helping me with my mood or my optimism by any means. And I don't know, really, I guess I should really be trying to focus on being more positive right now. I'm just struggling at this moment. And I will improve my mindset. But I wanted to share this moment with you folks, because I'm sure I'm not the only one who has these moments. And I just want to add to, like, this has honestly just been so ongoing. I just feel like I could not bring myself. We have those 3 frozen embryos. I could not bring myself to just say, I'm done. Let's destroy these. I really want all of those embryos to have a chance. But also, I am just getting to the point where we have been doing so many treatments that my life and my goals and my aspirations have just been put on hold for so long that I hope we have a family, but I just want to know either way. If it doesn't happen, I would be sad. But at this point, I feel like at least I would know where I stand, and I can start moving forward with just being myself and achieving the things I want to achieve, and not having to be physically restricted as far as, you know, the athleticism that I enjoy, or be restricted with my time as far as career aspirations. So yeah, I'm just kind of spinning right now, and like I said, I just want to share this. So if you're out there and you've hit a speed bump, and like you have a long history, and you know, honestly, like sometimes we just get tired, and I it's okay. I allow myself to honor that, and cry a little bit if I need to. And when I'm done, I write a list of everything I'm thankful for through my fertility journey, everything that's gone well, all the support I've received, how strong it's made my relationship with my husband, all those positive things. And I pick myself up and I keep pushing forward. But right now I'm honoring the struggle. So if you're out there and you're spinning, just take a second. I suggest it. Just take a second, sit down in a quiet space, and ask yourself, don't ask yourself, what does Google say about this? I found some good information, and that was fine. It brought to light for me some good questions I want to ask on Friday when I go in for my blood work. But I think it also brought up a lot of information that probably doesn't apply to me, and took me down a path I didn't need to go down. So forget about Google when you find yourself spinning. Sit down in a quiet space and check in with yourself and say, why am I hurting? And then honor it, accept it, release it, move forward. And to be honest, I think I'm saying that as much to you folks as I am to myself. So, I'll see you next time. Hoping to have the results from my test on Friday, and I'll share it with you. I'm sharing it all with you guys. So, anyhow, I hope you all the greatest success in your assisted reproductive journey, and I hope you keep well.